I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Hands, I'm your host, Dr. Tara, and today we're talking about when you should have a hysterectomy and some decision making that goes into that. I'm going to call this part one because my hope is that we can reel Dr. Unduke back in. He's super busy, but so amazing. I'm going to link episode that we did together a couple weeks ago on adenomyosis because it ties into this. And we talked a little bit actually about hysterectomy. Stop, listen to this, think about this before you get a hysterectomy in that episode. So my hope is that eventually we're going to get him back and we're going to record part two to this with him. So let's dive in and let's talk about hysterectomies and understanding endometriosis versus adenomyosis before surgery. Okay. So many of us, myself included, we're faced with this debilitating pain. Now there's many who have it way worse than myself. Many of you are walking around with daily pain. Many of you, I see in my practice every day. And it's conditions like endometriosis and adenomyosis that are present. And many of you don't even know you have it. The option you're presented with, especially with these heavy, cloudy periods, is a hysterectomy as a definitive solution. That's a big decision. And many of you have thought long and hard about this. And I want to preface this with only you can make this decision. You and your healthcare team. I almost said you and your healthcare provider, but if you listen to me long enough, you know I'm all about team and creating a team approach to your healthcare. And only you get to create that team. So I think having multiple options before jumping into surgery is really important. Trying everything before having surgery because it's a definitive solution. You can't go back from it. There's a heartbreak I see in my office far, far, far too often of young women who have never had babies, who have never had intercourse, having hysterectomies. And it's truly heartbreaking because then I also see them again later on. And we're going to share Abby's story. Abby is someone I talk about a lot. She's super involved with the nonprofit Everlasting Hope, which is a local nonprofit here in North Dakota and South Dakota, but very open about her story. You're going to hear more about how she was 21 years old, having a conversation with a boy she had just met, who is now her current husband, about how she had a hysterectomy. And if you want to continue dating, and as they got more serious, they had to have a conversation about how they were going to grow or start their family and if they were going to do that. They are now going through surrogacy, working a bazillion jobs to afford this. This is not a little decision to get a hysterectomy. There's the other flip side in my practice I see too. Perhaps we are in our 30s and get a hysterectomy and you get divorced because it happens. Trust me, if you know my story again, it unexpectedly or expectedly for some will happen. And you think you're done having kids and then you meet the love of your life and you want to have kids and you've had a hysterectomy. And now you're looking at six-figure surrogacy, very emotionally hard decision to make as well, or no kids at all with this individual. Again, this is a definitive solution that's being made way too young in women. So then we have, let's say you're 40, 50 years old. Again, 40-year-olds, perhaps you resonated with that conversation I was talking about getting divorced and having more children as well. But what's about the 50, 60, 70-year-old women who have had a hysterectomy and they still have symptoms? Maybe not the bleeding and the clotting, obviously, but the pain is still there that they had, that they were told was going to be resolved from a hysterectomy. That is almost always endometriosis. Hysterectomy is a cure for adenomyosis, not endometriosis. So it's really understanding this. The first 4 minutes of us talking here, but I hope you can just quick takeaway. But endometriosis and adenomyosis, while related, are distinct different conditions, and they have their own set of challenges and treatments and options. So it's really important to know the difference, recognize the symptoms. Some of the symptoms overlap, but they are different. Again, I'm going to link both of the Adam Duke episodes in today's show notes so you can help understand the value that specialized care and having a team makes when it comes to this. So endometriosis occurs when tissue similar, it's not the same, it is similar as the lining of the inside of the uterus starts to grow outside. And that leads to pain, irregular bleeding, GI symptoms, bladder symptoms, low back pain, knee pain, hip pain, shortness of breath, you name it, and potentially infertility. Adenomyosis, on the other hand, happens when the endometrial tissue grows into the muscular wall of the uterus. So your uterus is a muscle, but it's in that wall. And that's where we get more of that severe cramps, heavy bleeding, and large, soggy, boggy uterus. And the hard part for both is there's no testing or imaging that really can see it. Now, there's some advancements happening, and depending who's reading it, there's technologies coming out too to help hopefully, can an MRI see it? Can an ultrasound see it? But right now, you have to have surgery, more specifically excision trained specialist surgery to get that definitive diagnosis. So both conditions share some symptoms and they're common. Let's take a look at those. The severe menstrual cramps, the heavy menstrual periods, pain during intercourse, chronic pelvic pain, low back pain, acute or chronic. If you didn't have an injury or it only flares before, during your period or during ovulation, those ovulatory symptoms, red flag. Each condition has unique, less common symptoms as well. So endometriosis, we do typically see bowel movement, urination symptoms, gastrointestinal issues, fatigue. Adenomyosis is that chronic lower abdominal pressure, bloating, pain throughout the menstrual cycle, not just your period. A lot of that it's like a heavy feeling symptom in your pelvic area. I see fatigue with both, and I do see mental health with both as well. There's a mental health component to this disease. And let me tell you, after treating adenomyosis and endo, it does change and look different. It's crazy. We can do a whole separate episode on that. But the surgical dilemma, let's talk about this. Again, I'm going to just touch on this lightly. I'm going to let the expert, Dr. Adam Duke, share more about it in those other episodes. But when a hysterectomy might seem like the only option, relief, we need to understand there is more. And before making this irreversible decision, it's really vital to explore all avenues. Have tried everything, other specialists before delving into, because I call it a tragedy of women that we just talked about earlier, their 20s and 30s, that we see afterwards too. I have a lot of ethical concerns along with that as well, but we'll save that for a different day. Let's talk about the excision specialist versus OBGYN versus general surgeon. So an excision specialist is a surgeon with advanced training in removing endo. All day, every day, they are doing endo. They are no longer doing babies or hormone treatments or any other GYN OB cares. They are doing endometriosis all day, every day. Unlike general gynecologists and surgeons, excision specialists use this really precise technique that they've been trained in to remove all of the endo. There is no burning, no ablation, no cauterizing. And so this leads to that potential long-term relief and curative work we can then use as well if you were in the hands of this surgeon. This contrasts with more common surgical methods such as ablation, which just burns the surface of that lesion, leaving that underlying root cause. There's an image I use a lot in my practice. I'll have it in the app. I'll have it in other future trainings for you as patients to see them as well. But you're not getting the root. Think about gardening. Excision gets the root, and ablation burns and leaves behind and cause scar tissue as well. So your routine on regular OBGYN is really crucial for routine care, but they may not have that advanced specialized training or experience. Now, some do. There's some do. You have to really screen them. Nancy's Nook is a great place to find these providers. And general surgeons just do not have that understanding of these conditions. That is one area I will say to stay away from is general surgery to remove endo. I have seen a lot of not so good cases come from there. They're just not. The other part of it for everybody involved is that you have to be trained to spot it. It doesn't look like they maybe once were when they were in training. It looks differently now from research and study. And again, if you're seeing something all day, every day, thousands of cases, you're going to be in a better position to spot some of these more
abnormal, not so routine, regular signs of endometriosis as well. We really want to do everything we can to preserve fertility if desired and just really try alternative therapies before jumping to surgery. So, again, I really want to say that a team approach, not just a single provider, and growing your team is really crucial. Again, endometriosis and adenomyosis are super complex conditions. They impact every aspect of our life. I'm like pointing to me and saying me for watching this on YouTube because I probably have, I'm about to find out in June, but most certainly have endometriosis. I do know that from before. But we really want to improve quality of life from fertility to sex, to our sex life, to our mental health. It's an overall well. So you really need support from a whole team and really looking at this from a multidisciplinary approach before just diving into irreversible decision. And consider advocating for yourself through alternative things before just doing a hysterectomy. And again, I always want to talk about this, providing emotional and psychological support. Many of you have had chronic pain. Chronic pain creates a huge mental health crisis. And that is where having, again, a team approach to bring it in can really help too. So if you're considering a hysterectomy, take a moment, hit pause, explore all your options. The decision to undergo such a significant surgical procedure should not be made lightly. I know. The bleeding, Tara. The bleeding's awful and the symptoms are awful and I've had it for so long. But just remember, you cannot undo this decision. And with the right team who understands the full scope of treatment options and possibilities, traditional, non-traditional, you may find a path that offers some relief while preserving your uterus, preserving your fertility, and having some long-term relief before going to hysterectomy. Doesn't mean you're not going to have in the future. But really holding off as long as possible with that decision. Or if it's never felt right to you, deep down, it just doesn't feel right, but you're being kind of shuffled into that decision, just know that there is other options out there for you too. So remember, a well-informed decision is a powerful step towards reclaiming your life from chronic pain, chronic symptoms, and again, grow your team. You're in control of that. Thank you so much for listening to today's episode.